How to strengthen the lower back. Doing exercises to strengthen the lower back can help alleviate and prevent lower back pain. It can also strengthen the core, leg, and arm muscles. Please like, share, comment and subscribe this video.
Click on Zombie Apocalypse.
According to researchers, exercise also increases blood flow to the lower back area, which may reduce stiffness and speed up the healing process. Below, we explain how to do 10 exercises that strengthen the lower back and may help people manage lower back pain. 1. Bridges. Bridges work a person's gluteus maximus, which is the large muscle of the buttocks. People engage this muscle when they move their hips, particularly when they bend into a squat. The gluteus maximus is one of the most important muscles in the body, and keeping it strong can help support the lower back. To perform a bridge, lie on the ground and bend the knees, placing the feet flat on the floor, hip-width apart. Press the feet into the floor, keeping the arms by the sides. Raise the buttocks off the ground until the body forms a straight line from the shoulders to the knees. Squeeze the buttocks with the shoulders remaining on the floor. Lower the buttocks to the ground and rest for a few seconds. Repeat 15 times and then rest for 1 minute. Do 3 sets of 15 repetitions. 2. Knee to chest stretches. Doing a knee to chest stretch can help elongate the lower back, relieving tension and pain. To perform the knee to chest stretch, lie on the back on the floor. Bend the knees, keeping both feet flat on the floor. Use both hands to pull one knee in toward the chest. Hold the knee against the chest for 5 seconds, keeping the abdominals tight and pressing the spine into the floor. Return to the starting position. Repeat with the opposite leg. Repeat with each leg 2 to 3 times twice a day. 3. Lower back rotational stretches. The lower back rotational stretch can help relieve tension in the lower back and trunk. It also gently works the core muscles to improve stability. To perform the lower back rotational stretch, lie back on the floor with bent knees and feet flat on the ground. Keeping the shoulders firmly on the floor, gently roll both bent knees over to one side. Hold the position for 5 to 10 seconds. Return to the starting position. Gently roll the bent knees over to the opposite side, hold, and then return to the starting position. Repeat 2 to 3 times on each side twice a day. 4. Draw-in maneuvers. The draw-in maneuver works the transversus abdominis. This muscle is on the front and side of the abdomen, stabilizing the spine and lower back region. To perform the draw-in maneuver, lie back on the floor with knees bent and feet flat, keeping the arms by the sides. Breathe in deeply. While breathing out, pull the belly button toward the spine, tightening the abdominal muscles and keeping the hips still. Hold the position for 5 seconds. Repeat 5 times. Medical News Today newsletter. Stay in the know. Get our free daily newsletter. Expect in-depth, science-backed top lines of our best stories every day. Tap in and keep your curiosity satisfied. Enter your email. Your privacy is important to us. 5. Pelvic tilts. The pelvic tilt exercise can release tight back muscles and keep them flexible. To perform this lower back flexibility exercise, lie back on the floor with knees bent and feet flat, keeping the arms by the sides. Gently arch the lower back and push the stomach out. Hold for 5 seconds, then relax. Flatten the back and pull the belly button in toward the floor. Hold for 5 seconds, then relax. Increase the number of repetitions daily, building up to 30. 6. Lying lateral leg lifts. Lying lateral leg lifts work the hip abductor muscles. These muscles support the pelvis and can help reduce strain on the back. Keeping these muscles strong is essential, as they help a person maintain their balance and can affect mobility. To perform lying lateral leg lifts, lie on one side with the legs together. Keep the lower leg slightly bent. Draw the belly button into the spine to engage the core muscles. Raise the top leg about 18 inches, keeping it straight and extended. Hold the position for 2 seconds. Repeat 10 times. Turn onto the other side of the body and repeat, lifting the other leg. Perform 3 sets on each side. 7. Cat stretches. The cat stretch can help lengthen the back, make it stronger, and ease tension in the muscles. To perform the cat stretch, get onto the hands and knees with the knees hip-width apart. Arch the back, pulling the belly button up toward the spine. Slowly relax the muscles and allow the abdomen to sag toward the floor. Return to the starting position. Repeat 3 to 5 times twice a day. 8. Supermans. A person needs strong back extensors to maintain good posture. These muscles run along either side of the spine. Weak back extensors can reduce spinal and pelvic support, but doing an exercise called a Superman can help. To perform a Superman, lie face down on the ground and stretch both arms out in front of the body, keeping the legs stretched out and flat on the ground. Raise both the hands and feet, aiming to create a gap of about 6 inches between them and the floor. Try to pull in the belly button, lifting it off the floor to engage the core muscles. Keep the head straight and look at the floor to avoid neck injury. Stretch the hands and feet outward as far as possible. Hold the position for 2 seconds. Return to the starting position. Repeat 10 times. 9. Seated lower back rotational stretches. The seated lower back rotational stretch helps relieve pain, working the core muscles and strengthening the lower back. To perform the seated lower back rotational stretch, sit on a stool or chair without arms, keeping the feet flat on the floor. Twist at the core to the right, keeping the hips square and the spine tall. Position the hands behind the head or place the left hand on the right knee to support the stretch. Hold the position for 10 seconds. Repeat the exercise on the left-hand side. Repeat on each side 3 to 5 times twice a day. 10. Partial curls. Strong abdominal muscles play a significant role in supporting the spine and can also help keep the hips properly aligned. Weak abdominals can result in poor core strength and lack of stability, which can cause lower back pain. Curls and partial curls help build a strong core. To perform partial curls, lie back on the floor and bend the knees, keeping the feet flat and hip-width apart. Cross the hands over the chest. Breathe in deeply. On the breath out, engage the abdominal muscles by pulling in the stomach. Gently raise the head and shoulders 2 inches off the ground while keeping the neck in line with the spine. Hold for 5 seconds, then return to the starting position. Repeat the exercise 10 times. Perform 3 sets. Takeaway: performing exercises to work the core muscles can prevent injury, increase stability, and improve flexibility. People with lower back pain should also pay attention to their general posture and how they carry heavy objects to identify movements that may be responsible. Anyone experiencing lower back pain that is severe or does not go away with gentle stretches and exercise should make an appointment with a doctor. If any of these back exercises make pain worse, it is vital to stop doing them immediately and consult a doctor. No gym home workout. Get fit at home. You don't need machines at the gym to get fit. Your own body weight and gravity can do the job, and you'll work them with these 15 moves. Not active now? Check in with your doctor first, and if something hurts, stop. You're on your way to getting into your best shape. Wood chop. Your whole upper body gets a muscle-ripping workout here, including the abs. Start with feet hip-width apart, knees slightly bent. Attach a band overhead and grab it over the shoulder, trunk angled toward the band. Pull down to the opposite hip, rotating slightly. Slowly return. Standing tubing row. This move hits all the muscles used in a pull-up, as well as all your core muscles. Grasp the handles with straight arms and tubing taut. Pull the handles towards you and lean back a little. Focus on bringing your shoulder blades back and together. Pause and slowly straighten arms back to the starting position without bending forward. For safety reasons, do not lean back. Should the band break or come loose, there is high risk of fall. Circuit trained to burn fat. Want to burn fat quickly? Rapid fire circuits turn strength moves into calorie torching, cardio work. If your goal is weight loss, use light weights and low reps, says exercise physiologist Pete McCall, of the American Council on Exercise. A circuit may include push-ups, pull-ups, and crunches followed by a 2-minute run. Repeat or alternate with another circuit of biceps curls, dips, and shoulder presses to target smaller muscles. Pull-ups work arm and back muscles, giving you great bang for your buck. Having the palms facing you works not just the back but also targets the biceps. Grasp the chin-up bar and cross your legs to keep the lower body stable. Slowly pull your body up, bending your elbows, until your chin is level with the bar. Pause, then slowly return to your starting position. Repeat. Wide grip push-up. A wide grip makes the chest muscles work a little harder. Place your hands outside the shoulders. You should engage your core, thigh, and glutes to get the most out of this or any push-up. As you lift, think about gripping the ground with your hands to engage the large muscles of the pectoralis major, McCall says. Decline push-up. This challenging push-up can kick your shoulder strength up a couple notches. Get into a standard push-up, hands a little wider than shoulder width apart, fingers facing forward, elbows slightly bent, and eyes on the floor. Then place feet behind you on a stair, chair, or bench. Keep your body in a straight line, engage the abs, bend your elbows, and lower your chest towards the floor. Push back to starting position. Jump train. For power pro athletes, train with jumping jacks and other explosive moves to increase muscle power. It helps basketball players jump higher and tennis players get to the ball faster. Jump training is also called plyometrics, and it's not for beginners or for those with joint issues. But if you have good strength and balance, it can ramp up your game. Try adding plyometric moves to your workout once or twice a week. Jump squat. Shift your hips back and down until your heels start to lift off the floor. Explode up, swinging the arms overhead as you straighten your legs. Create a straight line from toes to fingers, with your back flat. Land softly on the middle of your foot and sink back into a squat to help absorb the impact. Jump lunge. Try this advanced move on grass or another soft surface. Sink into a lunge position with left leg forward, right leg back, and both knees bent to 90 degrees. Swing your arms behind you for greater power as you jump up, using your arms to assist as needed. Keep your back straight, eyes facing forward, and use your abs. Switch legs in the air and land softly, returning to the lunge position. Rest after each set. How to trim belly fat. To lose belly fat, you'll want a full body exercise routine that builds lean muscle all over. Muscle burns calories, even at rest. So having more muscle helps to melt fat all over, including the belly. The best plan is to make cardio, strength training, and a healthy diet part of your daily routine. Split squat with biceps curl. Rest your right foot on a step, stair or chair well behind you, with your weight on your bent left leg. Keep your head up, eyes forward, and weights at your side. Very important, keep the front knee directly over the ankle. Now, slowly lower your hips by bending the front knee. Push back up and pull the weights up towards shoulders, but don't twist the arms as you lift. Do all reps and switch legs. One-legged hamstring blaster. Strong hamstrings help power your legs. To challenge these muscles, lie with knees bent at a 90-degree angle and both heels on a chair or stair. Cross one ankle over the opposite thigh just above the knee. Now raise your hips as high as you can and keep your back straight, do not arch. Pause at the top and slowly lower hips back to the ground and repeat. Switch legs. Chair dip. This simple move tones the backs of the arms. Sit on the edge of a step or chair, palms on each side, and knees bent to 90 degrees. Now, move your hips forward, off the step, until your hands are supporting your weight. Slowly lower your body, keeping your back very close to the step. Bend the elbows until your upper arms are parallel to the floor. Slowly push back up and repeat. Double chair dip. To really challenge triceps, position 2 chairs facing each other. Sit on the edge of one, palms on each side of your hips. Straighten your legs and prop up your heels on the opposite chair. Scoot down until you're supporting your weight on your hands. Slowly lower your body by bending your elbows until upper arms are parallel to the floor, and keep your back close to the chair behind you. Slowly push back up and repeat. Love handles? Looking to trim your waist? Your best bet is to work on slimming down all over with a healthy diet and plenty of exercise. You can work on strengthening your core muscles with moves such as wood chops or planks. Basic plank. This move strengthens all the core muscles, helping to tone the midsection. Lie on your stomach, elbows close to your sides and directly under your shoulders, palms down. Using your abs, slowly lift your torso off the floor. Keeping your torso and legs steady. Don't let your low back sag and don't hike up your hips. Hold this position for 15 seconds or more, and don't hold your breath. Dynamic plank. Try this advanced move only after mastering the traditional plank. Support your weight with chest and forearms on top of a fitness ball. Keep legs straight and toes on the floor and contract the abdominals to help stay balanced. Shift your weight to your left leg as you bend your right knee and bring it up to meet the ball. Slowly return it to starting position and repeat. Switch legs. Two-legged hamstring curl. A slightly easier hamstring challenge uses two legs. Lie on the floor with heels and ankles on a fitness ball. Dig your heels into the ball and raise your hips as high as you can, while keeping your back straight. Do not arch. Now bend your knees to a 90-degree angle and roll the ball toward you. Pause at the top and slowly lower hips back to the ground and repeat. Ball plank with shoulder extension. Ready to work every muscle in your body? This move comes close, with a special challenge for the core. Put your chest, stomach, and hands, with weights, on a fitness ball, legs straight to the floor. Slowly raise one arm behind you, toward the ceiling. Contract your abs to keep from rolling off the ball, but don't forget to breathe. Pause, slowly return your hand to the ball, and repeat with the other arm. Protect your lower back if you have low back pain. Warm up by gently stretching your hips before working out. Kneel down on one knee with that foot trailing behind you. Keep your legs parallel to each other, hands on the bent knee, and let your hips sink forward to the floor. Don't lean forward. Your knee can reach beyond your ankle to put less strain on it. Hold for 30 seconds and switch legs. Sit much? Got a desk job? Get up each hour and move a bit, even if you're just walking around the office. Watch your posture. Your ears, shoulders, and hips should be in line. Gentle stretching can also help you feel better after spending all that time at your desk. How many reps are right for you? For strength and power, aim for 3 sets of 6 reps. For general muscle growth and toning, try 3 sets of 6 to 12 reps. If you're striving for muscle endurance, plan on 2 to 3 sets of 12 or more reps with 30-second rest periods. Remember, if something doesn't feel right, stop and check with a fitness expert. Depending on your health and physical condition, some exercises may be better for you than others. 30-minute workout routine. 30-minute fitness blitz. Think you don't have time to work out? You do. It's the intensity of your workout that's key. A short burst, high-intensity workout boosts your metabolism and tones muscles. Get moving with this 30-minute quickie routine that includes cardio and resistance training. If you're new to exercise, a man over age 45 or woman over age 55, or have a health problem, check with your doctor before starting a fitness program. Beginner squats. For thighs. If you're new at this, get started with a beginner version of squats using an exercise ball. Stand against a wall with the ball at your lower back, feet hip width apart and out in front. Keeping your body upright, slowly lower your body by bending at the hips and knees, dropping glutes toward the floor. Slowly move back to the starting position. Do 10 times. Squats. For thighs. Once you're ready, try squats without an exercise ball. For good form, keep your feet shoulder width apart and your back straight. Bend your knees and lower your rear as if you were sitting down, keeping your knees over your ankles. In the wrong picture, notice how the knees are too far forward. To target more muscle groups in less time, add an overhead press at the same time. With a dumbbell in each hand, rise from the squat position and push weights overhead, palms out. Do 10 times. Forward lunge. For thighs. Standing with feet hip width apart, take a big step forward with one leg, then lower your body toward the floor, front knee aligned with ankle, back knee pointing to the floor. Return to the starting position, and repeat by stepping forward with the other leg. For more challenge, hold a free weight in both hands and complete the lunge with a rotation in the torso, twisting the body toward the forward leg. Do 10 times on each side. Deadlift. For hamstrings. To do a deadlift holding a bar or free weights, stand up straight with feet hip width apart. Bend at your hips, moving the hips backward as you lower your upper body parallel to the floor. Keep your legs straight without locking the knees, and keep the back level and the spine in neutral. Lower the weight to just below your knees, then slowly return to the starting position. Do 10 times. Bridge. For glutes. The bridge works the glutes, butt, hamstrings, and core. Lying on your back with knees bent and feet hip-width apart, peel your spine off the floor, starting at the tailbone, forming a diagonal line from knees down to shoulders. Slowly return to the starting position. For an extra challenge, target your triceps by holding light weights, lifting your arms toward the ceiling as you raise your hips. Bend your elbows to lower the weights towards the floor. Do 10 times. Push-ups, for chest and core. Let's move to the upper body. Push-ups strengthen the chest, shoulders, triceps, and core muscles. Starting on all fours, place hands a bit wider than your shoulders. Place toes on the floor, creating a smooth line from shoulders to feet, keeping core muscles engaged. Lower and lift your body by bending and straightening your elbows. Too hard? Place knees on the floor instead of toes. To boost the workout, add an exercise ball under the hips, knees, or feet. Do 10 times. Chest press, for the chest. For a less demanding exercise than push-ups, you can try the chest press with weights. Lie face up on a bench, with knees bent or feet on the floor, spine relaxed. Press a bar or dumbbells from your chest toward the ceiling. Extend your arms but don't lock the elbows, and move slowly in both directions, keeping shoulder blades on the bench. For an extra challenge, do the chest press with your head and upper back on an exercise ball. Do 10 times. Bent over row, for back and biceps. The bent over row works all the major muscles of the upper back as well as the biceps. Begin the exercise in a bent over position with your back flat, one knee and one hand on the same side of the body braced on a bench. Hold a free weight in the other hand with arm extended. Lift the weight toward the hip until the upper arm is just beyond horizontal, see right. Then slowly lower weight to the starting position. Do 10 times. Shoulder press, for shoulders. A shoulder press works the shoulder muscles and can be performed standing or seated. For extra back support, use a bench with a back rest. Begin with elbows bent and weights at shoulders. Slowly reach toward the ceiling, keeping the elbows under the hands and the shoulders away from the ears. Slowly lower back to the starting position. Do 10 times. Cable pull down, for upper back. For the last upper body exercise, do the cable pull down, which works the upper back. Using a cable machine, sitting straight with a neutral spine, grasp the bar with arms extended. Slowly pull the bar down past the face and toward the chest. Only go as far as you can without leaning back, and control the weight on the way back up. Do 10 times. Bicycle crunch, for core and abdominals. Lying on your back on the floor, fold knees toward the chest and curl the upper body off the floor. With hands behind head, slowly rotate upper body to the right while drawing the right knee in and reaching the left leg out. Then rotate left and pull the left knee in and extend right leg out. Focus on bringing the shoulder toward the hip rather than the elbow to the knee, and keep the opposite shoulder off the floor. Do 10 times. Side plank, for core or abdominals. For another abdominal alternative, lie on your side with a bent elbow directly under your shoulder, and use your torso muscles to lift the body up into a side plank. Then lift the hips higher, then back to the plank, then lower. Do as many as you can with proper form, then repeat on the other side. If this exercise hurts your shoulder or neck, lift only your legs, keeping the hips stacked. Your head will rest on your bent arm. Go for 20 minutes before moving on to the cardio portion of the workout. Be sure you've completed 20 minutes of resistance training. If you have, now's a good time for a water break to keep your body well hydrated. If you haven't, go back and start the circuit over again until you reach the 20-minute goal. Cardiovascular training. Vary the intensity during your cardio workout. Use intervals, taking about a minute to get from moderate speed to intense. Whether you're on the stair stepper, the elliptical trainer, or the treadmill, do 30 seconds of the highest speed you can tolerate, then 30 seconds of normal speed. Then 30 seconds of the stiffest resistance you can handle, then 30 seconds of normal. Keep moving back and forth between speed and resistance until you've completed 10 minutes. How often? Do this 30-minute workout routine every other day, or do it 2 days in a row if that's better for your schedule. These are not hardcore exercises where you need more rest to recover. Exercises for lower back pain relief. How can I relieve my lower back pain? You feel it each time you bend over or stand up. It's that grown inspiring ache that shoots through your lower back and never seems to fully go away. Sometimes called lumbago or spondylosis, lower back pain is one of the most common forms of chronic pain among adults. Maybe you've been resting, hoping the back pain just needs time to heal. But most doctors now encourage lower back pain sufferers to get active and move their backs and related muscles as a better pain relief treatment. Movement can help relieve back pain, but only the right kind. Avoid workouts that put too much stress and strain on the back. So which exercises should you choose? That partly depends on how intense your pain is, and what causes it. So, you should always get the recommendation of your doctor before doing any heavy exertion for lower back pain. The following slides present several simple exercises that can help relieve lower back pain, and also highlight a few activities to avoid. With your doctor's approval, adding these movements to your workout routine can free you from your nagging, daily pain, leading to better overall health. Skip the toe touches. Fitness is often a great treatment for back pain, but some movements offer you little health benefit. Toe touches from a standing position can aggravate sciatica and other conditions by overstressing ligaments and spinal discs. Another cause for concern is the way standing toe touches can overstretch hamstrings and muscles in your lower back. How much pain is too much? Some mild discomfort and pain can be expected anytime you start a new workout. As you work your way back to better health and your muscles strengthen, that pain and discomfort should disappear. But when a fitness routine causes moderate or severe pain symptoms that lasts longer than 15 minutes, you should end the exercise and check in with your doctor. Pain relief. Try partial crunches. One of the classic core strengthening workouts is the partial stomach crunch. Partial crunches build strength in both your lower back and related stomach muscles, making this an ideal exercise for people with spondylosis. Here's how to get the most out of partial crunches. Lie back, and keep your feet flat on the floor with your knees bent. With your hands behind your head or with arms crossed around your chest, raise your shoulders from the floor. Make sure to keep your stomach muscles tight. Breath out while raising your shoulders. Avoid leading with your elbows, or yanking your neck off the floor with your arms. Hold for 1 second. Next, lower yourself back down to the floor in a controlled manner. Repeat with between 8 and 12 repetitions. Remember to follow proper form, which prevents excessive spine stress. Keep your feet, tailbone, and lower back against the floor throughout the exercise. Skip the sit-ups. Sit-ups are a fitness standard, but they're not as good at strengthening your core as you may think. Although most people see sit-ups as a stomach-strengthening activity, in reality people often use their hip muscles more than their stomachs when doing this exercise. Not only are they a poor choice for core strength, but sit-ups create pressure on spinal discs, which can lead to injury by increasing your lower back pain rather than lowering it. To maintain good health and improve low back pain, try more suitable workouts like the ones outlined further on. Hamstring stretches. Hamstring stretches relieve the back of the leg, where some of the muscles that support the work of the lower spine are found. As shown in the photo, this is a stretch that benefits from the use of a towel or fitness band. To perform a hamstring stretch, follow these steps. First, lie on your back with one knee bent. Next, thread a towel beneath the ball of the foot on the unbent leg. Pull back on the towel slowly, straightening your knee. You ought to feel a gentle stretch along the back of your leg. Hold the stretch for at least 15 to 30 seconds. For each leg, repeat 5 times. Avoid leg lifts once in a while. Leg lifts are suggested as useful treatments for lower back pain. That's because they help strengthen abdominal muscles, which play an important part in back health. Unfortunately, lying on your back and lifting both legs together can worsen back pain, and could cause injury. Instead of relying on leg lifts for better spine health, try this modified leg lift for lower back pain. First, lie on your back. Leave one leg straight, and bend the other leg at the knee. Next, lift the straight leg slowly up about 6 inches from the ground and briefly hold it in this position. Finally, slowly lower the leg. Repeat 10 times with the left leg, then switch to the right leg. Wall sits. When it comes to low back pain, try some wall sits as a break from sitting on the couch. To do these wall sits properly and without injury, follow these steps. Stand with your back facing the wall at a distance of about 10 to 12 inches. Carefully lean into the wall until your spine is flat against it. Slide down the wall slowly until your knees are bent slightly. Continue to press your low back into the wall. Hold this position for a count of 10, then carefully slide back up the wall. Repeat 8 to 12 times. Press up back extensions. Another treatment for back pain symptoms is the press up back extension. Here are the steps. Lie on your stomach. Position your hands directly underneath your shoulders. Push down on your hands. You should feel your shoulders begin to lift away from the floor. If you can do so comfortably, set your elbows on the floor directly beneath your shoulders. Then spend several seconds holding this position. Bird dog. It's a bird. It's a dog. No, it's a fitness routine to ease low back pain. The bird dog is a great way to learn to stabilize the low back during movements of the arms and legs. Here's how it is done. To begin, get on your hands and knees. Tighten your abdominal muscles. With one leg, lift and extend it behind you while keeping your hips level. Hold that position for a full 5 seconds. Now switch to the other leg. For each leg, repeat 8 to 12 times. For an added challenge, try lengthening the time you hold each lift. For each repetition, try lifting and extending your opposite arm in front of you. Don't allow your lower back muscles to sag. Stay in position. Don't lift your arms or legs any higher than the low back position can maintain. Knee to chest. Here's another way to get your legs pumping as a treatment for low back pain symptoms. Follow these directions to perform a safe knee to chest workout. Lie on your back. Put your feet flat on the floor and bend your knees. Draw your right knee up to your chest. Keep the left foot flat against the floor. Hold for 15 to 30 seconds. Meanwhile, be sure to keep your lower back flat on the floor. Next, lower your right knee. Repeat the routine with the left leg. For each leg, perform knee to chest 2 to 4 times. Pelvic tilts. Before back pain has you writhing on the floor with the usual symptoms, try lying on your back for some pelvic tilts. This workout is designed to strengthen your pelvis, which often works in concert with the core muscles along your spine. Making sure your abdomen can pull its fair share means your spine pain will have one less possible cause. Lie with your back and upper body on the floor with your knees bent. Keep your feet flat on the floor. Pull in your stomach. Imagining your belly button as being pulled toward your backbone, this helps keep your stomach tight. Doing this, you will notice your hips rocking back as your back and spine press into the floor. Hold this movement for 10 seconds, allowing your breath to smoothly enter and exit your chest. Repeat your pelvic tilts 8 to 12 times. Glute bridges. Bridging offers so much for the symptoms of back pain. This exercise helps strengthen various supporting players for your back like the hamstrings, glutes, transverse abdominis, abdomen and hips. It also works directly to strengthen the lower back. Follow these steps to assure a safe and rewarding bridge workout. Lie with your back to the floor, knees bent with only your heels touching the floor. Dig your heels into the floor. Squeeze down on your glutes. Lift your hips up until your shoulders, hips, and knees make a single, straight line. Hold this position for about 6 seconds. Slowly bring your hips back to the floor and give yourself about 10 seconds of rest. Repeat bridges 8 to 12 times. There are a couple of things to remember when bridging. First, try not to arch your lower back while your hips are moving upward. Next, avoid overarching. You can do that by keeping your abdomen tight both before and throughout the lift. Carefully choose a weightlifting regimen. If properly done, weightlifting will not exacerbate your back pain. In fact, you may feel that pain start to melt away as weightlifting begins to strengthen your lower back and supporting body parts. However, when your back pain comes on suddenly, what doctors call acute pain, the additional stress of weight training could put you in harm's way, potentially leading to injury. To use weightlifting as a back pain treatment, start by talking to your doctor. Your doctor can advise you on whether or not to lift weights. If they are recommended, your physician can advise you on which workouts to stay away from. Aerobic exercises. Aerobic workouts, sometimes called cardio, help strengthen the whole cardiovascular system, from the lungs and heart down to the blood vessels themselves. Aerobics can include biking, swimming, walking, or many other exercises that elevate your heart rate and get you moving. To start, try a short session. Then over time, lengthen the session as your stamina improves. Since back pain sometimes requires special care, try swimming as a treatment for your symptoms. In swimming, the water supports your body weight, giving your back a break. Be careful to avoid any strokes that require your body to twist. Some Pilates a routine that incorporates strengthening and stretching with a focus on the abdominal core sounds ideal for those who suffer from back pain symptoms. Pilates is a training workout that sometimes uses an apparatus called a reformer to emphasize flexibility and endurance along with strength. But many Pilates exercises can be performed without any special equipment. With help from an experienced instructor, Pilates may help some people with low back pain. Make sure your instructor knows about your pain ahead of time, as you may need to skip some moves. Losing weight for back pain relief. It's only natural to assume that, along with controlling your risk for heart attack, diabetes, stroke and other degenerative diseases, losing weight can help you get rid of back pain. Experts agree that losing weight successfully may result in partial or complete back pain relief. Dr. Andre Panagos, physiatrist and director of spine and sports medicine in New York notes, "Every single patient in my clinic who loses a significant amount of weight finds their pain to be vastly improved. The reason for this," Panagos explains, "is that if you are heavier than your ideal weight, your muscles will need to work harder in order to help you accomplish everyday tasks. Plus, the extra load that is put on the spine can take vertebrae out of alignment, which may lead to joint strain, another potential cause of pain. When you lose weight, you are effectively reducing strain on your spinal column and back muscles," Panagos adds. Weight loss and back pain. Medical research makes a pretty good case for the relationship between back pain and obesity. But it still has yet to confirm that obesity is an actual cause of spine problems. That said, a 2016 study published in the journal Medicine did find that high-intensity back pain and/or disability was associated with increased obesity in a large sample of men. 1. More and more, health professionals are directing their patients toward making common-sense choices for the purposes of pain management. These include maintaining a physically active lifestyle and keeping weight in check. If you are morbidly obese, i.e., 100 or more pounds overweight or a BMI of 40, or you are 35 years of age or older and experiencing obesity-related health issues such as high blood pressure, you should work with your doctor to lose the weight. In fact, it's best to speak with your doctor before embarking on any weight loss program. How much do you need to lose to get relief? How thin is thin enough to get back pain relief? Many experts recommend staying within 10 pounds of your ideal weight to keep your back healthy and pain-free. Once you know your caloric goal, maintaining a healthy diet that restricts calories and engaging in regular exercise is crucial to achieving your ideal weight. The good news is that physical activity also helps manage back pain. In fact, exercise may be your best bet for preventing and managing chronic low back pain. Exercise programs for weight loss and back pain. A 2016 study found that sticking with a general exercise program may help you reduce chronic non-specific low back pain. Such a program might include strength training, stretching and aerobic activity. The study authors say that developing flexibility may help improve functional movement, and aerobic activity may increase blood flow and nutrients that go to the soft tissues of the body. This, in turn, may help reduce back stiffness. And don't forget your core. The researchers say that a strong core plays an important role in support of the low back. Aerobic activity and back pain. A key ingredient in nearly every type of weight loss program. Aerobic activity is any rhythmic motion that uses the large muscles of the body and is maintained continuously for at least 10 minutes. Obviously, choosing activities that minimize pounding on your joints is best if your back is hurting. Walking, and in particular, cycling, swimming, and aquatic exercise are good low and moderate impact activity choices. 30 minutes of aerobic activity performed 5 days per week is the amount generally recommended by experts for realizing health benefits. If that's too much, start with less and build up over a period of weeks or months. You can also accumulate workouts throughout the day. For example, walking for 15 minutes twice per day counts as 30 minutes of aerobic exercise in one day. Key here is to do less than 10 minutes at a time. Strength, flexibility and back pain. It's well known that strengthening and stretching trunk muscles, especially the abdominals and muscles around the hips, provides support for upright body posture and for the spine itself. Regular practice of yoga, Pilates or other mind-body workouts can help you do just that. These types of programs help develop balanced strength in the muscles that control the pelvis and trunk. This, in turn, can protect your back by facilitating an even wear and tear on your joints and by taking the load off your spine. See above for a few ideas. Exercise precautions for people with back pain. While exercise is highly touted for reducing back pain, some conditions warrant safety modifications. For example, exercise is not recommended for an acute low back injury. Ask your doctor or physical therapist for guidance if you feel you need it. Meanwhile, here are a few tips. Try to find the right level of intensity and time, not too much, not too little. If you have acute low back pain or sciatica, for example, a good rule of thumb might be, instead of doing a workout, set a goal of avoiding bed rest but also remaining pain-free as you resume daily activities. If you just can't get comfortable with the exercise, or it seems as though pain follows your every move, you may want to try an even gentler approach. Activities that seek to relax the tension and realign your body posture may help condition muscles and lubricate joints. In turn, this may help prevent re-injury and prepare your tissues for more intense exercise. Some examples of the gentler approach might include a water exercise routine or restorative yoga pose sequence that consists of pelvic tilts, spinal twist, cat-cow stretch, Tadasana. A restorative series of Pilates exercises, aptly named pre-Pilates, will likely give you a full body range of motion and gentle abdominal workout. Other activities that are gentle but can get you moving again include Tai Chi and Feldenkrais. Exercises for low back pain. Almost everyone experiences low back pain from time to time. According to the Mayo Clinic, low back pain is one of the most common reasons people give for missing work. It's also one of the most common reasons for a doctor's visit. There are many causes of low back pain, but some of the most commonly cited include poor posture, excessive sitting, improper lifting techniques, accidents, and sudden strains and sprains. The muscles and ligaments of the low back help support the spine and allow smooth, powerful movement during activity. If these muscles are weak, shortened or fatigued, any sudden forceful movement can result in an injury. Low back pain can often be prevented by using good body mechanics, improving posture, getting up and moving frequently, and doing some basic back and core strengthening exercises. Physical therapy and conservative home treatment is generally the most successful method for dealing with active episodes of back pain. Back pain prevention exercises. The best way to prevent back pain is to establish a healthy lifestyle that keeps the back and core muscles strong and flexible. Here are a few tips to protect yourself from low back pain. Move more. Too much sitting can harm your health, so get up and move for a few minutes every hour. According to more and more research, sitting for long periods causes the muscles of the lower body to simply shut down, which has harmful health effects, including decreased metabolism, increased risk of diabetes, obesity, and cardiovascular disease. So, get up and do at least a few squats or walk around for a couple of minutes every hour. Stay flexible. Basic back stretching exercises will help maintain good posture, body mechanics, and flexibility. It's important to remember that the goal of stretching is to develop and maintain an appropriate range of motion around specific joints. With regard to the spine, athletes generally need to have good mobility and movement in the thoracic spine, upper back, while the lumbar spine provides a solid base of support and stable. Even though any sort of stretching may feel great after exercise or after sitting a long time, the real benefits of a specific stretching routine is that it can help maintain an appropriate range of motion around specific joints. It's even more helpful if stretching and releasing tight muscles goes hand in hand with strengthening and stabilizing the weak ones, as explained in the next tip: glute activation. Get your glutes firing. If you sit for long stretches, you may end up with weak glutes, tight hamstrings, and tight hip flexors. This sort of muscle imbalance is another reason some people develop low back pain. in addition to getting up more frequently to activate the muscle of the lower body. Performing a specific glute activation routine will help get your backside firing properly and alleviate some of the imbalance caused by long-term sitting. It's also a great routine for athletes to incorporate into a warm-up so that the strongest muscles in the body can fire properly during exercise. Strengthen your back and core. Doing a simple back and core strengthening routine will help you maintain solid body mechanics by strengthening the core muscles that provide support and stability to the spine. Some of the most helpful and often overlooked back strengtheners include the bridge exercise, the back extension exercise, and the arm and leg extension exercise. Activate the transverse abdominis (TVA). The transverse abdominis (TVA) muscle is the deepest of the abdominal muscles and one of the main core stabilizing muscles of the lumbar spine. A weak TVA is often related to low back pain, but one simple exercise can help strengthen this muscle. Build more overall strength. There is some evidence that building overall strength with a basic weight training exercise program can help reduce back pain. One study published in the Journal of Strength and Conditioning reported that strength training was significantly more helpful in reducing low back pain and improving patient functioning than engaging in an aerobic exercise conditioning program. The study program used resistance exercises. Exercises for lower back pain relief. Back pain relief exercises help lose the back pain. Workout not working? Who has time to waste on ineffective, risky exercises? Not you. So ditch these 7 moves that won't deliver the results you want, and may even cause injury. Only people with very mobile shoulder joints can keep their spines straight enough to do this exercise properly. No. 1. Lat pull down behind the head. The problem: only people with very mobile shoulder joints can keep their spines straight enough to do this exercise properly. So the move, done wrong, can lead to several complications including shoulder impingement or worse, a tear in the rotator cuff. And if the bar hits the back of the neck, it could injure cervical vertebrae. On the pull-down machine, lean back a few degrees, use a wider than shoulder grip, and bring the bar down in front of your body to the breastbone, pulling shoulder blades down and together. A safer lat pull down. On the pull-down machine, lean back a few degrees, use a wider than shoulder grip, and bring the bar down in front of your body to the breastbone, pulling shoulder blades down and together. Contract your abdominals to stabilize the body, and avoid using momentum to swing the bar up and down. The lat pull-down works both lower and upper back muscles. This shoulder move, in which you lift a barbell up and down behind the head, can cause the same problems as the lat pull-down behind the head. No. 2. Military press behind the head. This shoulder move, in which you lift a barbell up and down behind the head, can cause the same problems as the lat pull down behind the head. A safer shoulder alternative: when doing the military press, keep the bar in front of your head. A safer military press. A safer shoulder alternative: when doing the military press, keep the bar in front of your head. Stand with the weight no lower than the collarbone and keep your upper body upright. The exercise can also be done seated. Always sit straight against a back support, and keep the natural curve in your spine, with upper back and glutes pressed to the chair. Pulling weights, a barbell, or a weighted cabled bar up under your chin can compress the nerves in the shoulder area. No. 3. Upright row. The problem: pulling weights, a barbell, or a weighted cabled bar up under your chin can compress the nerves in the shoulder area. Instead of doing an upright row, work your shoulders with a front or lateral shoulder raise, lifting weights out to the front or side of the body. Safer alternative to the upright row. Instead of doing an upright row, work your shoulders with a front or lateral shoulder raise, lifting weights out to the front or side of the body. Keep a slight bend in your arms. From a reclining position, you push the plate up and bring it down in this common exercise to work the quadriceps, hamstrings, and glutes. No. 4. Leg press with cramped knees. From a reclining position, you push the plate up and bring it down in this common exercise to work the quadriceps, hamstrings, and glutes. The greater the motion, the more joints are worked through full range, which is good. However, if there is pain at any point during the motion, do not go any further. If you want to do a lying leg press, keep your butt from rotating off the back of the machine. Leg press, safer moves. If you want to do a lying leg press, keep your butt from rotating off the back of the machine. Push from the knees as far as you can, but if you experience pain, do not stretch as far. The greater the motion, the more the joints are worked. The bar on the machine doesn't give, which can force the body into risky positions. No. 5. Squats on the Smith machine. The problem, the bar on the machine doesn't give, which can force the body into risky positions. Plus, people tend to put their feet farther in front of their bodies when doing squats on the machine, which makes matters worse. It's not necessary to use weights when doing a squat, but if you keep good form, adding weight will intensify the move. Squats, a safer alternative. It's not necessary to use weights when doing a squat, but if you keep good form, adding weight will intensify the move. Standing straight with your feet shoulder width apart, slowly lower your body, back straight. Move the hips back as if you are going to sit in a chair. Try to maintain your weight directly over your heels. Slowly return to a standing position. Hunching over or using a death grip on the handrail cheats your body and can throw off your alignment, jarring your spine, shoulders, and elbows. No. 6. Bad form on cardio machines. The problem, hunching over or using a death grip on the handrail cheats your body and can throw off your alignment, jarring your spine, shoulders, and elbows. Don't set the incline or resistance so high that it causes you to hang on to the machine too tightly. Better technique on cardio machines. Don't set the incline or resistance so high that it causes you to hang on to the machine too tightly. Use a natural gait with a light grip. For a more challenging workout, hold on lightly with one hand and move the other arm, switching arms periodically. Walking on a treadmill without holding on also helps strengthen your core. And save the reading for after your workout so you can focus on good form. You can't isolate fat loss to one part of the body. No. 7. Exercises for spot reduction. People who do strengthening and toning exercises in an effort to trim fat from a certain area, thighs, hips, stomach, or arms, have the wrong idea. Although these exercises can help firm muscles, if the targeted area still carries an extra layer of fat, it won't look much different. You can't isolate fat loss to one part of the body. Cardiovascular exercise will torch calories, but resistance training is a big part of the equation if you want to burn fat. Best ways to reshape your body. Cardiovascular exercise will torch calories, but resistance training is a big part of the equation if you want to burn fat. Boosting your muscle mass increases your metabolism, so you burn more calories all the time, even when you're not working out. Even if you're doing everything else right, your efforts can be undermined by improper footwear. Can bad shoes trip up your workout? Even if you're doing everything else right, your efforts can be undermined by improper footwear. Working out with the wrong shoes increases pounding on the joints, and can lead to injuries like plantar fasciitis or tendinitis. The key, experts say, is to choose a shoe that is specific to your activity and that suits your particular foot. Shoe solution. The key, experts say, is to choose a shoe that is specific to your activity and that suits your particular foot. They recommend shopping at stores specializing in athletic shoes, where you can seek advice from a knowledgeable salesperson. And don't forget to replace your shoes when they show signs of wear. Does your workout really work? Done right, these 7 exercises give you results that you can see and feel. You do them at a gym or at home. Watch the form shown by the trainer in the pictures. Good technique is a must. If you're not active now, it's a good idea to check in with your doctor first, especially if you have been diagnosed with health concerns. For example, if you have advanced osteoporosis, some of these exercises may be too aggressive. 1. Walking. Why it's a winner, you can walk anywhere, anytime. Use a treadmill or hit the streets. How to. If you're just starting to walk for fitness, begin with 5 to 10 minutes at a time. Add a few minutes to each walk until you get to at least 30 minutes per walk. Then, quicken your pace or add hills. 2. Interval training. Why it's a winner, interval training boosts your fitness levels and burns more calories to help you lose weight. The basic idea is to vary the intensity within your workout, instead of going at a steady pace. How to. Whether you walk, run, dance, or do another cardio exercise, push up the pace for a minute or two. Then back off for 2 to 4 minutes. How long your interval should last depends on the length of your workout and how much recovery time you need. A trainer can fine-tune the pacing. Repeat the intervals throughout your workout. 3. Squats. Why it's a winner. Squats work several muscle groups, your quadriceps, quads, hamstrings, and gluteals, glutes, at the same time. How to keep your feet shoulder width apart and your back straight. Bend your knees and lower your rear as if you were sitting down in a chair. Keep your knees right over your ankles. Add dumbbells once you can do at least 12 reps with good form. Squats done right. Practice with a real chair to master this move. First, sit all the way down in the chair and stand back up. Next, barely touch the chair's seat before standing back up. Work up to doing the squats without a chair, keeping the same form. 4. Lunges. Why it's a winner. Like squats, lunges work all the major muscles of your lower body. They can also improve your balance. How to take a big step forward, keeping your back straight. Bend your front knee to about 90 degrees. Keep weight on your back toes and drop the back knee toward the floor. Don't let the back knee touch the floor. Lunges. Extra challenge. Try stepping not just forward but also back and out to each side, with each lunge. Add dumbbells to lunges once your form is down pat. 5. Push-ups. Why it's a winner. Push-ups strengthen your chest, shoulders, triceps, and core muscles. How to. Facing down, place your hands slightly wider than shoulder width apart. Place your toes on the floor. If that's too hard, start with your knees on the floor. Your body should make a straight line from shoulders to knees or feet. Keep your rear end muscles and abs engaged. Bend your elbows to lower down until you almost touch the floor. Lift back up by pushing through your elbows. Keep your torso in a straight line throughout the move. Push-ups. Too hard? Too easy? If you're new to push-ups, you can start doing them by leaning into a kitchen counter. As you get stronger, go lower, using a desk or chair. Then you can move onto the floor, starting with your knees bent. For a challenge, put your feet on a stair, bench, or couch while keeping good form. 6. Crunches. Method. Start by lying on your back with your feet flat on the floor and your head resting in the palm of one hand and the other hand reaching toward your knees. Press your lower back down. Contract your abdominal muscles, abs, and in one smooth move, raise your head, then your neck, shoulders, and upper back off the floor. Tuck in your chin slightly. Lower back down and repeat. Crunches. Method B. You can also do crunches with your feet off the floor and knees bent. This technique may keep you from arching your back. It also uses your hip flexors, muscles on your upper thighs below your hip bones. Mastering crunches keep your neck in line with your spine. Tuck in your chin so it doesn't stick out. Breathe normally. To keep chest and shoulders open, keep your elbows out of your line of vision. 7. Bent over row. Why it's a winner. You work all the major muscles of your upper back, as well as your biceps. How to. Stand with your feet shoulder width apart, bend your knees, and bend forward at the hips. Engage your abs without hunching your back. Hold weights beneath your shoulders, keeping your hands shoulder width apart. Bend your elbows and lift both hands toward the sides of your body. Pause, then slowly lower your hands to the starting position. Can perform with a bar or dumbbells. Mastering bent over rows. First, do this move without weights so you learn the right motions. If you have trouble doing bent over rows while standing up, support your weight by sitting on an incline bench, facing backward. Fibro-friendly exercises. Less pain, more energy. Don't let the muscle pain and fatigue of fibromyalgia keep you on the sidelines. You can, and should, get moving. A few simple tweaks to common exercises can boost your energy, ease pain and stiffness, lift your mood, and improve your sleep. Check with your doctor before you start. Get warmed up. Take time to loosen your muscles first. It will help you avoid injury. Start with your feet and work your way up. Make slow, circular motions, clockwise and counterclockwise, with all your joints until they move easily. If it hurts, stop. Stretch more, hurt less. Daily stretches can help your joints move more smoothly. You may hear this called range of motion. Focus on the big muscle groups: calves, thighs, hips, lower back, and shoulders. Hold the stretch for 30 seconds. Stop if it hurts. Try to stretch 2 to 3 times a week. Calf stretches. Here's how to do this move. Face a wall. Place your palms flat on the surface, 1 foot forward and 1 foot back. Leave your heels on the floor and lean forward. Feel the pull in your calf and the Achilles tendon at the back of your ankle. Hold the position for 30 seconds. Switch legs and repeat. Stretch each calf 3 times. Aerobic exercise. This is one of the best ways to take charge of your fibromyalgia. An aerobic exercise uses your large muscles over and over for a set period of time. Walking is the easiest, and you don't need any special tools other than a good pair of shoes. Swimming and biking are also good options. The trick is to find something you like and do it for 30 minutes a day, 5 days a week. If you need to start with 10 minutes and work your way up, do it. Boost your muscles and mood. Strength exercises can lower your pain and help with depression. You don't need to lift a heavy barbell. What matters here is the range of movements you take your muscles through. Before you start, get tips from a trainer at a fitness center. Ask how to use handheld weights, elastic bands, or strength training machines the right way, so you don't injure yourself or make your pain worse. Isometric chest press. If regular strength training hurts, try exercises called isometrics. You'll tense your muscle without any visible movement. Here's how. Hold your arms at chest height. Press your palms together as hard as you can. Hold for 5 seconds, then rest for 5 seconds. Do this 5 times. Slowly build to holding the press for 10 to 15 seconds at a time. If this move is painful, ask a trainer to show you another isometric chest exercise. Isometric shoulder extension. Stand with your back against a wall and your arms at your sides. With your elbows straight, push your arms back toward the wall. Hold for 5 seconds, and then rest. You can repeat this 10 times. If the move hurts, ask a trainer to show you another isometric shoulder exercise. Ice your pain. If you overdo it during your workout, a cold compress can help. It eases pain and swelling. You can wrap the cold pack in a towel so it isn't right against your skin. Leave it on for 20 minutes, then take it off for the same amount of time. How much is enough? If you're just getting started with exercise, choose low to moderate intensity activities. Your choices include mall walking, swimming, water aerobics, using a kickboard in a pool, yoga, tai chi, or biking. Start slow and increase the time and intensity as you can. Again, your goal is to work up to 30 minutes a day, 5 days of the week. Daily activities count. Household chores like mopping floors, washing windows, and mowing the yard are exercise. So are fun things like gardening and playing with kids or grandkids. Anything that gets you moving can help when it comes to boosting fitness and easing your symptoms. Yoga for body, mind fitness. This blend of stretches and meditation can also help you get more fit. The postures you hold, called asanas, ease aches and pains. And the exercises that teach you to focus your thoughts, called dharana, can help you overcome fibro fog. Meditation keeps your mind in the present, which help you handle pain. What type of yoga works best? Vinyasa is a type that mixes deep breathing with gentle stretches. It's a great way to improve your health. You'll need to find a good teacher who knows how to work with someone who has fibromyalgia. Check with your local community center or gym. Or ask your support group, an online fibro community, or your doctor for suggestions. Qigong for muscle pain. This ancient practice is known as the mother of Chinese healing, and it's pronounced Qigong. It combines meditation, dance, movement, and breathing techniques. Studies show it can improve energy, lessen fatigue, and ease pain. Visit the National Qigong Association's website for more information. Tai Chi boosts flexibility. This exercise helps you relax. Think of it as meditation in motion, with gentle, flowing movements instead of forceful actions. It can lower your stress, improve balance and flexibility, and build muscle strength. Sign up for a class at your fitness or community center. Heat can help. Use it before and after a workout to ease any pain and stiffness or to reduce muscle spasms. Heating pads, heat lamps, and warm baths or washcloths are all good choices. Use the heat for 20 minutes, then stop for 20 minutes before you try it again. Please like, share, comment and subscribe this video. Thanks for watching my video.